This is Crystal Manning, Medicare Specialist at JRG Advisors. I want to thank everybody for participating. I also want to let you know that we will be sharing this PowerPoint with you after the presentation within a few days, and we are recording it. So we will also be sharing that recording within a few days. I'd like to, before we get started, welcome our valued clients and partners, which are the Chamber Choice, the Pittsburgh Builders, PBIP, the CBBT products, the PHA benefits program, the York County Garagemen, First Commonwealth, Health Alliance for Nonprofits, our PANA partners, and our PTC Corporate Coverage Group. Thank you. Today we're going to be going over what the 2016 open enrollment means, what the eligible plans are, what they do, what you need to do now, how Medicare Advantage plans work, what a Medicare Plus Choice or Medicare Part C plan is, how the coordination works with employer benefits, and once again, if we have any questions, feel free to type them in and hit send. So I'm going to go ahead and start here. Medicare open enrollment for the upcoming 2016 calendar year occurs between October 15th and December 7th. It's the window for more than 50 million Medicare recipients to review, tailor, or change their policies. What does this mean to you? This means that an insurance carrier may change their copayments, premiums, and their maximum out-of-pockets, as well as provide some additional or delete benefits. During this time, you have the opportunity to change your Part D drug plan, switch from an original Medicare plan to a Medicare Advantage plan, or vice versa. The changes that you make will take effect during the January 1st start season. If you are enrolled in a Medicare supplement plan, you will not need to do anything. You have the guaranteed coverage for life as long as your premiums are paid. Medicare is your primary payer and your supplement is the secondary. Any provider that accepts Medicare will honor your supplement product. The best time to purchase a Medicare supplement, or what they call a Medigap insurance policy, is during your 6 months open enrollment when you turn 65 and pick up your Medicare Part B. During that period, an insurance company cannot use medical underwriting. That means they cannot refuse to sell you any Medigap policy that they offer, make you wait for your coverage, or charge you more for any of your past or present health problems. If you have a Medicare Advantage plan or a standalone Part D plan, you should receive an annual notice of change or an ANOC letter and or an evidence of coverage from your plan by the end of September. These notices for any changes of your current plan's cost, benefits, and rules for the upcoming year. If you are dissatisfied with any of the changes, you can make that change for your coverage during this fall open enrollment season. That change in your current coverage will take effect for the January 1st, 2016 plan year. But remember, even if you're satisfied with your current Medicare Advantage coverage or your Part D prescription plan, it is important for you to compare your current plan to what it's offered in 2016 and look at other carriers to ensure that your plan is still the best and at the affordable cost that you want. Alternative plans may offer better health and or drug coverage at a more advantageable, affordable cost to you. Just a simple switch to comparing plans can save thousands in out-of-pocket cost, and that includes your prescription drug copays. My advice is to start early. There are many Medicare Advantage plans in our area, as well as about 29 prescription drug plans to consider. Just research your options and make sure you understand what you'll receive and how this may affect your out-of-pocket. This includes checking deductibles, which can change from year to year, and copays. Make sure that your doctor's hospitals are still in the network. Make sure that your drugs are still in the network and what tiers they're on. And if you're still working or have retiree health care benefits, make sure that you understand how those benefits coordinate with Medicare. Medicare Advantage plans are approved by Medicare and run by private carriers. These plans must follow the rules by Medicare and take the place of Medicare rather than function as a supplement to your coverage. These plans are getting monies from Medicare to give you the benefits. So they must provide all plans that Part A, hospital insurance, and Part B, your medical insurance, and must cover at least all of the medically necessary services that you incur. This coverage can include Medicare drug plans and extra benefits such as dental, vision, as well as health club membership. Today, there are alternatives to a traditional structure of the original Medicare plan, coupled with a Medicare supplement insurance. The Balanced Budget Act of 1997 authorized the use of alternative health plans, including some types of managed care plans to provide Medicare benefits. The goal at that time was to give Medicare beneficiaries more health plan options and to help control Medicare cost. The alternative program was known as a Medicare Plus Choice Plan, or Medicare Part C. But in 2003, the Medicare Prescription Drug Improvement and Modernization Act made additional refinements to the Medicare Plus Choice program and renamed it Medicare Advantage. These are typically known as an HMO, your health maintenance programs, the PPO, the Preferred Provider Organization, or the SNP plans, the Special Needs programs. Finding the right Medicare plan and figuring out deductibles and worrying about prescription coverage, donut hole, can be confusing enough, particularly for seniors entering a healthcare system for the first time. Even if you're still on the job and have health insurance through your employer, if you're 65 or older, the new health insurance marketplace isn't for you. It's illegal for someone who knows that you have Medicare to sell you a marketplace plan. Some Medicare plans during the past year may have been altered, or the premiums may have risen or fallen. So my advice is don't ignore your opportunity to compare plans now, and don't assume that your plan will not change. The changes will be small, but they may be changes which you need to pay attention to. Last year, certain plans were discontinued and deductibles increased. Many seniors were unaware of this until they went to use their plan. Medicare celebrated its 50th anniversary on July 30th. This program has transformed health security for older and disabled Americans. Medicare has protected many millions from poor health, premature health, and medical bankruptcy. President Lyndon Johnson signed the program into law in 1965. Medicare choices have become more complicated through the years, and so have our lives. It's wise to discuss your Medicare options with an experienced Medicare specialist to avoid any penalties or confusion to make the best choice for you. So once again, if you have any questions, please type them in and send them, and I'll answer. Okay, well, I want to thank everybody for attending today. Feel free to give our office again a call if you have any questions. We will be sending this PowerPoint and my summary to you within the next couple days. Thank you.